Paiute were predominantly a desert culture, scattered across a variety of landscapes from the Red Rock Canyons of the Colorado and Green River watersheds to the Basin and Range country far to the west and the Wasatch Mountains to the north. The present-day bands have remained separate entities for centuries. The five bands go by the names of the Cedar, Indian Peaks, Ganache, Kusharem, and Shivwits. The Kusharem band of Paiutes was nearly wiped out in 1866 during the Circleville Massacre and subsequent attacks in Paiute settlements. Mormon settlers had conflicts with the Utes further north in Utah during the Utah Black Hawk War, which increased fears amongst local settlers in the south. Over 30 men, women, and children were captured and executed at the massacre. In April 2016, locals, along with LDS Church, erected a monument to those slain. The five bands had separate reservations with tribal governments until 1954, when Utah Senator Arthur Watkins pushed for the termination of the federal responsibility over the tribes, violating multiple treaties. It took over 20 years to help repair the federal trust with the tribes and reestablish tribal sovereignty. With hard work, the Paiute Tribe of Utah, PITU, was successfully created on April 3, 1980, by an act of Congress with delineations created for each band. Their small tracts of land pepper the southwestern corner of the state, as well as the central areas, from near Richfield to the north of St. George. As of 2015, the total number of Paiute natives was 918, which is up from the lowest population of less than 800. The Navajo inhabit the largest Indian reservation in the entire United States, covering an area one-third the size of Utah itself, stretching from the beginnings of the Grand Canyon eastward across Canyon de Chelly into the high plateau of northwestern New Mexico. Though there were over 25,000 Navajos, they lived in smaller, scattered bands with tribal leaders never commanding larger communities. The Spanish first made contact with Navajos around 1581. Tensions would eventually arise in the 1700s, leading to the eviction of the Spaniards from the eastern Navajo lands. During this period, over 100 men, women, and children were massacred near Canyon de Chelly in 1805. As the United States seized control of the Southwest from Mexico, harsher subjugation ensued, with multiple failed treaties, often overburdened with the loss of Navajo lands. After multiple battles and raids, the U.S. Army, under the leadership of Kit Carson, forced the relocation of 9,000 to 10,000 Navajos in what is known as the Long Walk of 1864. A couple hundred innocents died along the 300 miles as they were forced to march without aid from their captors. Once at Fort Sumner in New Mexico, mismanagement and raids from the Comanches forced the abandonment of the small reservation. The Treaty of Bosque Redondo permitted the Navajo to return to their homelands. There, they became unified from the experience and worked arduously to regain their lands. A large tribal government was created in 1923 with 88 delegates from 110 chapters that was reorganized to have an executive, legislative, and judicial branch in 1991. Today, the tribe consists of roughly 250,000 members, though at one time their population had dwindled to 2,000. The federally funded Indian Health Service, an operating division under the auspices of the U.S. Department of Health and Human Services, is in charge of medical care and health resources for Native tribes officially recognized by the U.S. government. To improve health care for residents of reservations, the IHS was created in 1956 as part of a bureaucratic shift from the Bureau of Indian Affairs to the public health system. In 2015, the budget of $4.6 billion covered a total of 2.2 million American Indians and Alaska Natives, equivalent to $3,099 for each Native person served. This is less than half what is spent on non-Natives nationwide, which is roughly $8,097 per person. The Indian Self-Determination and Educational Assistance Act, also referred to as Public Law 638, caused a big shift in management practices of the Indian Health Service. Rather than concentrating the funds from the federal government and operating from the central hospital network, funds are now allocated directly to the tribes according to their census numbers. They are required to comply with federal standards with the goal of becoming patient-centered medical homes. With these changes, tribes like the Paiutes and the Navajo have developed their own corporations for the administration of healthcare services to their people.